Good evening and thanks for joining us. China, the epicenter of a potentially deadly virus, has extended the lockdown on more of its cities, restricting travel for millions of people as it ramps up efforts to contain the spread of the new coronavirus. At the same time, the World Health Organization says it is still too early to declare a global public health emergency.
Make no mistake, this is, though, an emergency in China. But it has not yet become a global health emergency. It may yet become one.
China now says 25 people have died, and there are now more than 800 confirmed cases in the country. 10 cases have been confirmed outside China, in Japan, South Korea, Singapore, Thailand, the U.S., and Vietnam. There are no confirmed cases in Canada, and the health minister says the risk here is low. There are some suspected cases, though. Quebec's health minister says 5 patients are under observation in quarantine at 3 different hospitals in Montreal and 1 in Quebec City. A 6th person has been cleared after it was determined they had the flu.
We're, of course, looking at any extra measures that need to be taken to keep Canadians safe and to prevent the spread of this virus.
We have complete coverage tonight, including what the symptoms are and what's being done to develop a vaccine. But we begin with the situation in China, where those lockdowns are in place in several cities and hospitals are struggling to manage all the people who are showing up to be tested for the virus. Redmond Shannon has our top story.
A megacity of 11 million people on lockdown at the busiest travel time of the year. Almost everyone outside is now wearing masks, including security forces. Medical staff in the busy hospitals appear to be taking every precaution.
As you guys can see, the streets are a bit empty.
Canadian medical student Deek Omar lives in Wuhan and has been filming as the city prepares.
As you can see, the situation here is critical. All public transportations here have been suspended until further notice. It's a bit concerning, but there's no real actual panic as things here are being handled in a calm manner.
As of 10 a.m. local time on Thursday, no one was allowed in or out of the city. Later in the day, the city of Guangdong, 60 kilometers away, was also closed off, followed by travel restrictions in nearby Aju and the smaller cities of Chubei and Qigong. That's devastating for citizens during this holiday season in China. Even in the capital Beijing, 1,000 kilometers from the outbreak, Lunar New Year celebrations have been cancelled after authorities confirmed the first death outside of the region where the virus originated. In a much-awaited announcement, the World Health Organization says this is a health emergency in China, but not a global emergency yet.
We know that most of those who have died had underlying health conditions such as hypertension, diabetes, or cardiovascular disease that weakened their immune systems.
The WHO says cases so far of human-to-human transmission appear to be isolated to within family groups.
There is still a lot we don't know. We don't know the source of this virus. We don't understand how easily it spreads. And we don't fully understand its clinical features or severity.
Redmond joins me now. Redmond, China was criticized for how it reacted to the SARS outbreak, and there are concerns it may have been slow to react in the case of this new virus. What are experts saying about that?
Well, Dawna, the WHO is praising China for identifying the genetic sequence of the virus and for sharing it with them. And a virologist in a US lab that helped identify SARS told me that China is applying the lessons learned from SARS and appears to be doing everything that it can right now, given that this is a very new virus. He also told me that he expects more important information to come out of China within the next week or two. Dawna?
All right, Redmond Shannon in London, thanks. The WHO says there are a lot of unknowns about this disease, from the source to how it spreads and its clinical features. It's important to note not everyone who gets it dies from it. They do know about 1/4 of people with confirmed cases have become seriously ill. Here's what China's Health Commission has released about 17 of the people who have died. 13 were men, 4 were women. The youngest was a 48-year-old woman. The oldest were 2 89-year-old men. The WHO says those who have died had underlying conditions such as diabetes, heart disease, or Parkinson's. Coronaviruses are named for the spikes that protrude from their membranes, which resemble the sun's corona, and they can infect both animals and people. They cause illnesses of the respiratory tract, ranging from the common cold to pneumonia. Signs of infection include fever, cough, shortness of breath, and breathing difficulties. For now, there is no specific treatment for people who have it. Work is underway on a vaccine in a number of labs around the world, including here in Canada. Heather Yourex-West reports.
In this University of Saskatchewan lab, researchers are trying to do something that's never been done before.
Part of our institute's mission is to respond to emerging virus threats, and this new virus, this new coronavirus in China would certainly represent one of those.
The Vito Intervac lab recently got the green light from the Public Health Agency of Canada to start working with the new coronavirus. It's now in phase 1, building samples of the virus using the genetic sequence released by Chinese health officials.
My lab primarily works on MERS coronavirus, so we have experience in this area.
Outside Canada, other labs are already working on this. A global coalition set up in 2017 to fight epidemic diseases just announced funding for 3 separate research teams who are also trying to develop a vaccine. One of them, Inovia Pharmaceuticals, has shown some promising signs. It hopes to have a vaccine for this coronavirus ready for human trials by summer.
Most recently, we worked with our partners to get a vaccine against the Zika virus from bench to clinic, and we did that in about 7 months. So we're working very hard to do this even faster. It's an evolving situation, and we're trying to move as quickly as possible.
But until a vaccine is developed, there is little that can be done to prevent this threat, making containment all the more important. Heather Yourex-West, Global News, Calgary.